Since our founding in 1973, we've been through amazing growth and change as an organization. But our singular commitment to expanding women's and girls' access to safe, legal abortion has remained constant. As the global movement for abortion rights has evolved to focus on abortion as a human rights and justice issue, not only a public health issue, so has Ipas. Our enhanced emphasis on meaningful and perhaps new local partnership to drive sustainable change, and our new internal approach to shared internal leadership has spurred us into a network of allied organizations and advocates advancing a concrete agenda to advance reproductive justice for all people, regardless of gender, race, ethnicity, age, ability, sexuality, religion, or environment.
Nigeria is a religious and cultural country. Our ecosystem is highly dominated by religious influence and cultural influence, which subjugates women in society below men. Our cultural practices, which religion practices built upon, then portray the fact that men are superior to women, men are the leaders, and like we say commonly, men are the head of the family. So what that means is that the men determine what happens to everybody in the family, including their wife. The wife does not have an equal opportunity to contribute to family decision making. So based on that, it means that even issues around sexual and reproductive choices, the women have very little opportunity to engage, to even determine when to get pregnant, for instance, how many number of children she should have. All of that is determined by the man, which is where, so by the time Ipas came into Nigeria in the year 2000, we needed to work with the Ministry of Health to see how do we support women, empower women to be able to take the right decision for themselves, but also empower healthcare officers, healthcare workers to know the right thing to do when a woman approaches an healthcare provider for support. Ipas is all about creating an enabling environment for women to get the best healthcare they need. Over the years, Nigeria have had high numbers of maternal mortality. Right now, we have the highest in the world in terms of absolute number of women who are dying because of pregnancy-related issues. And at least 10% of those deaths are linked to unsafe abortion, preventable deaths. Those are deaths that could have been prevented, for instance, if safe abortion is widely available, or if contraception is also widely available, irrespective of your age, irrespective of your marital status. If it's easily available across the counter, most of the unsafe abortion we have, unwanted pregnancy we have in Nigeria, will be averted, which also means that most of the unsafe abortion we have in Nigeria will be averted, and that will reduce the maternal mortality by at least 10% in our country. And that's a lot of women we're talking about. To you and I, it might be just numbers, just statistics. But to families who have lost a wife, a sister, or a daughter to complications arising from unsafe abortion, that's absolute number of a loved person and not just numbers.
In recognition of these limiting barriers to reproductive health, we understand that it takes partnership to reach the most vulnerable and farthest women and girls behind.
Our new strategic framework also makes explicit the complex factors in an individual's life, personal, community, and political environment they live in that governs whether or not they're able to realize their reproductive health and rights. It also recognizes partnerships to achieve our mission, to ensure that abortion and contraceptive care are available and accessible for women everywhere in Nigeria and around the globe.
So at the heart of our rebranding is to position ourselves to be able to address issues around reproductive justice. I won't go into the historical context around it, talking about reproductive rights, reproductive health, and now the emergence of reproductive justice in recent times. But the point remains that there are diversities of issues which interconnect, what we call intersectionality of oppressions that deny women and girls access to bodily autonomy, and some of which could be things like youth and adolescent movements, disability rights. Okay, there are quite a number of them. Right? And the idea basically is you cannot address one and leave out the other. Let me give you a simple example. If you talk about youth and adolescent rights, it has a bearing on issues around disability rights, because some of the young persons you're going to be talking about could fall within that category. So if you're addressing only the youth issues around youth and adolescents, and you don't pay attention to issues around disability rights, you may not achieve reproductive justice. So for us as an organization, what we seek to do as we rebrand is to serve as that convener of thought to advance issues around reproductive justice as we galvanize other stakeholders and partnerships that address the different areas that we may not be able to fully address as a singular organization. And I think it's important to underscore that point, which is that when you look at the various intersecting oppressions, there is really no one organization that will be able to fully address all of them. And that is why there is that need for us to, as much as possible, continue to build partnerships that ultimately help us move towards addressing and advancing reproductive justice in Nigeria for women and girls and marginalized groups.
As Ipas, we have evolved to addressing these barriers that limit women and girls to self-determine their reproduction and sexuality. Our brand has morphed to reflect our ongoing effort to put power in the hands of the people closest to our work.
We understand that this goal cannot be achieved alone. Therefore, we build collective action in partnership with other actors to ensure that all women in Nigeria have full bodily autonomy. We are Ipas. We are partners for reproductive justice. Join us on the journey.